1.2 million Americans died from COVID. Millions more are grappling with something called long COVID, and doctors are trying to figure out exactly how to treat it. Well, now scientists are looking into a possible link between COVID and cancer. Public health data shows an increase in the number of rare stage 4 cancers among Americans starting in late 2020, a time when the pandemic was in full swing. In the years that followed, doctors noticed some alarming trends. More and more young patients were coming in with very rare cancers. Others developed several different kinds of cancer at the same time. And patients in remission for decades suddenly relapsed, their cancer coming back. Little wonder why my next guest is calling for the government to investigate the possible connection between cancer and COVID. Joining us now is Dr. Kashyap Patel, CEO of the Carolina Blood and Cancer Care Associates, and two of his patients, Bob and Bonnie Krall, who have dealt with 3 different kinds of cancer between the two of them just in the past 14 months. Great to have all of you with us. Doctor, you're not the only one who noticed this trend, but you started noticing your patients were getting very, very rare kinds of cancers that were also very aggressive, and other doctors were reporting the same thing?
Correct. Thank you very much for getting me onto your show, Elizabeth. I think this is a very important issue to me because we started noticing some very unusual pattern. For example, there's a cancer called cholangiocarcinoma, the gallbladder cancer. It's rare. Maybe get about 7,000 to 8,000 cases in the US a year. Between 2021 and 2023, we saw close to 7 patients, and the average age is more than 65 years. We saw a lot of them in between 40 and 50 years. And some of them died within a matter of weeks to months. So that was first sign that we saw. Then I started seeing multiple cancers in same patient. Like some patients had 3 new cancers within a matter of 2 years' time. So we started inquiring, and I asked my partners, every Friday we get together under our healing dome and talk about our patients. And what I saw was everybody had observed the same thing. And one more feature I want to point out. I help many international patients across from India, and typically I used to get 1 referral request every other week. There's not been a single week goes by when I see requests from 25-year-old, 30-year-old, rare cancers, never smokers. So it's really worrisome.
So you're seeing this very rare cancer popping up in patients far younger than you ever saw before, much more frequently than you ever saw before. And it's not just here in the US. You have colleagues in India who are noticing the same thing. Bonnie, I want to ask you, you went to Dr. Patel because you were having stomach pain and what you thought was long COVID, only to find out you have stomach cancer?
I had retroperitoneal sarcoma in my abdomen. I had an 8.5-pound tumor in my abdomen.
Oh my gosh. And this came out of nowhere. Do you have cancer in your family, your biological family?
Well, my dad did, but he was a welder, a smoker. He had every reason to have cancer. I had no reason to have cancer. And I was healthy in December, and by April, they diagnosed this cancer.
And Bob, you were also diagnosed with cancer, a very rare blood cancer, and 4 of your friends also have it?
I have CLL, chronic lymphocytic leukemia. Several people in the neighborhood have that, but I also had mantle cell lymphoma, and they do not have that.
How close to having COVID? You both had COVID. How many times did you have it, and how severely did you have it?
We never even knew Bob had it. He never had any symptoms, and I had 2 very light cases, I believe.
But the doctor said you both had high levels of COVID antibodies in your bloodstream.
Right.
Yes. Mine was both of ours were at the top level of the chart.
So, doctor, we know that COVID can set off a whole cascade of inflammatory responses in people's bodies. The former director of the American Association of Cancer Research said, quote, COVID wrecks the body, and that's where cancers can start. Is that what you think might be happening here?
Yes, ma'am. So what happens is that long COVID triggers inflammatory changes in the body, and inflammation is now a very well-known risk factor for cancer. So inflammation actually aggravates multiple pathways that can trigger cancer in susceptible individuals. So
Wait, doctor, slow down a little bit because you're talking about really fast. I want to make sure our audience can hear everything you're saying. Inflammation, which is a hallmark of the COVID, of contracting COVID, inflammation in the body is also a precursor to cancer. Is that what you're saying?
It does. So inflammation triggers many genetic changes in our genome that can create a propensity of developing cancer in certain individuals.
But couldn't the spike in cancers also be a result of people failing to get screened or diagnosed during the pandemic when we were all under lockdown?
You raise a very important point, but the rare cancer that we see that we've never seen before, the multiple cancer in the same patients that we see, and the link to long COVID inflammatory biomarkers, which we are studying right now. So I'm analyzing close to 300 patients' data on the inflammatory biomarkers in the body with long COVID antibody titers, and if they had an unusual cancer that they had.
Bonnie and Bob, we know that viruses can cause cancer. 15 to 20% of cancers in the United States are caused by viruses like HPV or Epstein-Barr or hepatitis B. Do you think that your 3 cancer diagnoses are related to you having COVID?
Who knows? I mean, how could we ever know that? You know, we were both healthy as could be. We had just finished a giant trip to the Western United States. We came back and bam, Bob was diagnosed. We got back in July and he started his treatments in August.
What's your prognosis?
I'm in remission thanks to Dr. Patel.
And I think I'm close, right, Dr. Patel?
Indeed. So I'm so happy to see that both of us are doing well. But I want to add one more piece here.
Yes.
So Bonnie has started treating her for a long COVID before she developed cancer. Didn't you remember, Bonnie? So she had body pains. We checked her for long COVID, and boom, 4 months later, we had cancer.
Right.
Bonnie was being treated for long COVID for 4 months before the cancer diagnosis. And doctor, just to be clear, you and other doctors from several different states, even in India, I believe, are all calling on governments to investigate this potential link because you find this alarming. Listen, Dr. Patel, Bob and Bonnie Krall, thank you so much for joining us. Bob and Bonnie, I wish you nothing but good health. And thanks to Dr. Patel.
Thank you very much.
Yeah, it looks like you're doing well.
He's been our leader and pathfinder, and he's done a wonderful job for both of us. And we appreciate him and you for publicizing this.
Yep. We're going to stay on top of this story. Please stay in touch with us. Keep us posted on how things are going. And doctor, we would like to hear about any more insights you're getting on these trends because they are alarming. Thank you, all of you, for joining us.
Thank you very much.